If you've had any health challenges this year, you've most likely come across the word vagus nerve. Or if you've looked into the words the brain and dove into books about how much the vagus nerve affects us and our function, you know a lot about it already. So when you learn more about the vagus nerve, you will learn that it plays a huge role in our gut, our heart rate, our respiration, our mood, our emotions, and so much more. The reason I want to talk about the vagus nerve is because if your child is struggling with a multitude of symptoms that aren't really connected, and you could be wondering why are all these different symptoms happening at the same time, the vagus nerve might be that factor on what's connecting them. In this video, what we're going to talk about is what the vagus nerve is, what it does, if your child has a disorder of their vagus nerve, and what that might be presenting like symptomatically for them. Then we're going to talk about how to measure that vagus nerve dysfunction, since that is super important as well. So the vagus nerve is a nerve that actually starts right up here in the cranial bones, meaning it's directly connected to the brain. So it's pretty important. It actually goes to multiple places in the body if you look up the anatomy of it. It goes first to the lymph nodes in the neck to regulate drainage and our immune system. It goes down into the heart to down-regulate that heart rate and calm your heart rate down. It goes to the lungs to help with respiration and breathing. And it even goes down and connects into the gut. And that helps to regulate our microbiome, which is super important. So in essence, this is a very important nerve, especially if someone has multiple symptoms going on and they can't connect the dots. Typically, vagal nerve disorders stem from some sort of trauma, whether it be a sickness, lots of inflammation, or what we most commonly see in our office is birth trauma is a big culprit. So being in the neck region, the vagus nerve is naturally the recipient of a lot of birth trauma because it is the first area that gets a ton of traction, twisting, and pulling in that birth process. And that's with very little intervention sometimes. If you need a vacuum, if you need forceps, if you need all these different things to help get that child out of the birth canal, then that's going to put even more stress on that poor vagus nerve. Any assistance with that delivery process can cause struggle to the vagal nerve area. So if your child is struggling with a lot of the symptoms that we talked about and also had a difficult delivery, it likely seems that they could have vagal nerve dysfunction. So we want to help these kids. That's what we do in our office every day because only neurologically focused pediatric chiropractors are restoring that vagal nerve function with specific adjustments and gentle adjustments that we do in our office. So you might be wondering, how do we measure that? How do I even know if my child's dealing with vagal nerve dysfunction? So we actually have an awesome technology in our office called Insight Scanning, and it's non-invasive scanning that assesses the health of your nervous system. So one of the components of that is called heart rate variability, or HRV. And so that basically tells you how your vagus nerve is functioning, or autonomia. So I'm going to show you what that looks like over here. So right here we have a graph. On this side, we have our rest and digest side. And then on the other side, we have our fight or flight side. So that little white dot there is showing us that we're not in the most optimal area here. So this scan was taken on one of our patients in our office. She was an 8-year-old that was stuck in fight or flight. She had a lot of anxiety. She was not sleeping well, which we could see as you go lower on this graph here. That white dot was lower. So she had less autonomic function, or what we call vagus nerve function. And so the higher that white dot goes on the graph, the more energy you have in your tank, the more adaptability you have in your reserve, the more autonomic activity you have. So basically your vagus nerve is functioning well. So ideally we want to see all of our patients in the middle green area, that rectangular green area. So when she first came to us, she was not in a great spot, which we could tell symptomatically that there's a lot going on. She was struggling with ADHD behaviors, lots of anxiety, biting and picking her nails, struggles with school. She was a picky eater as well. There's all these different things that told us that her body had a lot of symptoms going on. So we immediately thought to ourselves, there's probably something going on with her vagus nerve. So when we did this scan, we saw that she was actually low in her autonomic activity, and she was shifted more to the fight or flight side. So the sympathetic response of her body over there. So when we measure that and see that, that tells us that they probably need more care and more frequency in the beginning to get their brain and their body out of that fight or flight and back into that rest and digest. A big component of this is sleep. And so the first thing that we noticed when she started care at a higher frequency is that she started sleeping through the night, which was the first time Mom said in her whole life that she had been sleeping through the night. So that was huge. When we took another scan on her in our office, her little white dot moved all the way up to the edge of the green area by that first progress scan, which is a huge result for her. And that told us she was sleeping better. She was moving more out of that fight or flight state, and her body was able to function better. So she started to be less anxious. She started to focus better in school, and little things like sensory things wouldn't get at her like they used to prior to chiropractic care. So parents, this is a big thing that you want to look into if your child is struggling with multitude of symptoms. So if there's a lot going on with your child and you can't really connect the dots, look to the vagus nerve. Find someone who takes this HRV test and measures that and measures how the vagus nerve is functioning so that we can see how we can help your child. So let us know if we can connect you with someone near you, or if anything with this resonated with you, please tell a parent near you about this, that could help their child as well. I hope you have an awesome day.